Well, it's good to be with you again. This is my third 180-day plan update. In this video, similar to the second, you're going to hear not just from me, but from some other members of either the senior leadership team or other leaders that we have throughout the organization. You're going to hear from Dr. Bandela, our Chief of Ambulatory Care. He's going to talk to you about PACT optimization. This is an area where we've made a lot of progress. I'm really excited for where we're headed in primary care, and would like for you to pay close attention to Dr. Bandela as he's telling you what they've done in primary care to improve access. You're also going to hear from Dr. Fashina, our Chief of Staff, and Garrett Roof, the Group Practice Manager. They're going to talk to you about some changes that we've made in scheduling and scheduling oversight. Some things you all requested of me during my transition briefings, and your proposals I approved, and they're going to give you updates on where we are with making those changes. You're also going to hear from Andrew Garcia, your Associate Director. Andrew's going to give you an update on our strategic planning activities. We had a very well-attended strategic planning summit the first week of August, where we brought in our community-based outpatient clinics and laid out some strategies for those sites going forward. So Mr. Garcia will give you updates there. You'll also hear from Human Resources, Mary Dorfler, our Chief of HR, and several of our labor partners. They're going to give you updates on what we're doing to improve our labor management relationship. Again, some things that you talked to me about that we are deploying strategies to address. Last but not least in this update, you'll hear from our Assistant Director for Operations in Waco, Amy Maynard, and Charles Yale, our Acting Chief of Engineering, giving you a few updates on what we're doing to modernize our facility to make sure that we're well positioned to compete with our private sector counterparts. I'd like to talk to you about a few things today before we transition to their updates. First is the All-Employee Survey. If you haven't taken the survey, I would encourage you to do so. The All-Employee Survey is going to run from August 7th through August 28th. Interestingly, I do read every Speak to the Director that I receive, and I received one a few days ago from an employee that was asking, why we're being asked to participate in the All-Employee Survey. And in that same message, they expressed some concern about some things in their work area that they didn't really think were up to their expectation. My response to that employee was, that is the reason why you should complete the All-Employee Survey. I need to hear from you so that I know what's important to you, how you're received in your work area, and what sort of things we can do to improve your environment so that we can be an employer of choice. So I do encourage you to complete the All-Employee Survey. As many of you may recall, during my first 180-day plan update, I talked to you about focus groups that I was going to do in the organization with our labor partners. Those focus groups were done using last year's All-Employee Survey results. So I really would love to hear from you this year so that I'm clear where in the organization I'll need to focus my attention over the next year. I would also encourage you, if you haven't become familiar with the new accountability legislation that was passed by Congress, including the House and the Senate, and signed by the President in June. This is landmark legislation and changes not just how we do business from a supervisory and staff perspective, but really changes our culture. So I would encourage not just supervisors, but frontline employees to become familiar with that legislation. There's a lot of information about it you can access from our website. You can get in touch with Human Resources. But I do expect throughout our organization to continue to see our culture improve for the better, much of which will be done using the new accountability legislation. A few other things that have happened since my last update to you. We had our first veteran forums. These were well attended. We substituted veteran forums for the monthly staff meetings that we've done historically. We had one veteran forum here in Temple where we had 3 veterans come in and talk to us about their experiences in our organization. They shared with you things that really have gone well for them and what's kept them with Central Texas Veterans Healthcare System. But they also talked to us about some opportunities for improvement. I really enjoyed seeing the interaction between our staff and the veterans that we serve. I think it's going to position us all to improve our relationship and ensure that we are our veterans provider of choice. So we had a veteran forum here in Temple. We had another in Austin. And again, both were well attended, and I thank the staff and veterans that attended those sessions. And we plan to have more of those in the future. Last but not least, I mentioned a Speak to the Director earlier. I want to talk to you about another one that I received about 2 weeks ago. This was an interesting letter that I received from an employee who told me that they'd been with our organization for 30 years. and that in their 30-year career, they were a bit disheartened and felt as if they, using a quote from the employee, had seen this organization over the last 30 years go downhill. Obviously, I was taken aback and disheartened as I read that message. So I continued to read it. The letter went on to say that they didn't think that the culture in the organization was really capable of change, and that they were writing me this letter really to get these feelings off their chest, but they didn't really think anything was going to change as a result of them sending me that letter. So I really wasn't sure what to do after reading it. But what you will see is a response that I'm sending to that employee in our newsletter. And my response to that employee is simply that first I wanted to thank them for their 30 years of service to our organization and to the veterans that we serve. Truly, I appreciate that. And to some degree, I agree with what that employee told me. I agree that our culture won't change, but it won't change as long as those that are responsible for creating the culture are they themselves not willing to change. So as employees, it's important to understand that the culture of the organization doesn't exist alone. That culture comes from those that walk the halls and walls of the organization, that serve our veterans, that interact with our veterans, that interact with each other. We create the culture in the organization. So to that end, I disagree. I don't agree that the culture in the organization can't change. I think it's ripe for change, as long as we have individuals in the organization that are willing to change. So with that, I hope you enjoyed the rest of the updates that you'll see in this 180-day plan video. And as always, thank you for choosing Central Texas.
What is PACT and what can it do for you? PACT is a short for Patient Aligned Care Team. Each team consists of a provider, an RN, LVN, and a clerk. Central Texas healthcare system has 78 teams throughout our system. The PACT team goal is to have a rapport with each veteran to help them achieve their personal goals to get healthy and avoid hospitalization. We do this through what we call PACT optimization. This means each team meeting the goals set forth in our performance measures, including 2-day discharge calls, huddling, and scrubbing. At this time, we have 46 PACT teams achieving the goal of optimization. The core of the PACT team is the PACT RN, who is the captain of a rowboat, and the provider is the guide or the rudder of that boat. An LVN and an AMS's staff are rowing this boat. The boat is the veteran and his health care. A perfect alliance and cooperation of this PACT team is essential for the veteran's health care and to go from here to a 5-star primary care experience. This is PACT optimization as I understand it. Terry?
PACT makes sure that on a veteran's discharge, a call is made and each veteran is okay and their health care needs are being met. For this measure, we have gone from reaching just 44% of discharged veterans in October 2016 to only 10 months later reaching 71% of those veterans. We care about each one of our veterans. Huddling and scrubbing are done to ensure appropriate care is given to the right patient. The PACT team huddles every day to make sure their game plan just like when a football team huddles. Scrubbing the scheduled list includes a call to the veteran. This increases the bonding of the patient with the PACT team and knowledge of their healthcare needs. Chronic Disease Management, or CDM for short, is a group of highly trained nurses of our healthcare system who are involved in chronic disease management of COPD, diabetes, hypertension, and is designed for individualized care. This is a veteran-centered approach. During CDM, the nurse provides veterans with tools and resources to achieve their goals, such as diabetic classes, Health Improvement Program, or HIP for short, and My Healthy Vet. Central Texas also has a new RN call center in place for veterans, same-day access. Our nurses are only a telephone call away, and in the future, veterans will be able to see the nurse they are talking to in a video chat. Having a good relationship between the PACT team and our veteran is essential.
We are committed to providing the best possible care for our veterans to meet their health care needs. Thank you.
Hello. At Central Texas Veterans Healthcare System, we are giving every veteran the opportunity to schedule an appointment before leaving the clinic. Instead of asking the veteran to call us sometime in the future to schedule an appointment, we have created a more veteran-centric process. This begins with better trained schedulers. We want to ensure that every veteran is scheduled as timely and accurately as possible, whenever and wherever that may be. Currently, before any new scheduler is issued the access to schedule our veterans for upcoming appointments, he or she is required to complete a 2-week face-to-face schedulers training course, which includes a pre-test and post-test evaluation.
We know that our patients will have questions before arriving at our hospitals or clinics. Not being able to get in contact with the right person in a timely manner is critical and can certainly be frustrating. Central Texas has activated a large contact center which has significantly increased the overall timeliness of answering incoming calls, as well as reduced the number of veterans who hang up before getting their needs met. We at Central Texas currently rolling out an improved scheduling program called Vista Scheduling Enhancement. Many of our staff are using this program today, and by the end of September 2017, we expect all staff to use this new format when appointing our patients. This enhancement allows the scheduler to track, sort, and prioritize multiple appointment requests more efficiently. Ultimately, this will reduce the waiting time for the veteran as he or she is checking out of their clinic with an agreed upon future appointment date.
And finally, all staff who supervise schedulers are required to audit their staff scheduling compliance. We owe it to our veterans to give them timely and accurate appointment choices, and that begins and ends with courteous and skilled staff assisting our patients in this process. Thank you very much.
Good day, everyone. Today I wanted to take a few minutes of your time to share with you the strategic planning activities that are occurring here at the Central Texas Veterans Healthcare System. On August 1st to the 3rd, we held our first strategic planning retreat whose focus was specifically on our community-based outpatient clinics. During this retreat, we had an opportunity to bring all of our administrative and clinical service chiefs, as well as the leadership teams of those clinical community-based outpatient clinics, those being Brownwood, Palestine, Cedar Park, and College Station. During this 3-day retreat, we had an opportunity to hear many great recommendations and proposals that were able to be discussed amongst the entire audience and multitude of services that were present during this retreat. As a result of this retreat, we were able to focus on some specific initiatives that will assist us in improving access to care for our veterans in those communities that are a good distance away from us, as well as improving the veteran experience as well and the employee experience. Again, as a result of that 3-day retreat, the outcome was many recommendations that were subsequently, I shouldn't say all, but about 80% of those recommendations were approved. Those recommendations will come with additional FTE that will be added to our community-based outpatient clinics. Those FTE will go to supporting activities such as distribution of prosthetics at our community-based outpatient clinics. Many know that our veterans have to drive great distances sometimes just to come here to receive a prosthetic device. Well, we want to make it easier for them. Other areas of focus for us during this retreat were expanding the telehealth modalities that are offered at our community-based outpatient clinics. So those areas as well will be receiving additional FTE. So as we progress throughout the remainder of this fiscal year and move towards implementation of these recommendations, we will continue to provide you all input and I guess a status check on how things are progressing, because we as a team are here to support the needs of our veterans. Many of you are asking, well, what about Temple, Waco, and Austin? Very good question. In the first quarter of 2018, we are planning a strategic planning retreat to focus on space, access, and efficiency. And during this retreat, we look forward to working with each of our clinical service chiefs and our administrative service chiefs, as well as our frontline staff, to help us meet each of these objectives.
Hello. Human Resources has been working on the Director's 180-day plan, which includes 20 hours of mandatory training for all supervisors starting in fiscal year 18. Working with our labor partners, Human Resources created a work group that developed the training plan. It's composed of weekly classes on various topics ranging from information on discipline, leave, diversity, sexual harassment, and creating functional statements, just to name a few. Also included in the mandatory 20 hours of training will be 10 core hours that each supervisor must take. These 10 core hours will be taught each month and are comprised of topics selected by our labor partners, as well as information contained in the new VA Accountability Act of 2017, such as process improvement and how to motivate, manage, and reward employees. I ask all supervisors, please check your emails for the 2018 training schedule, which is set to be released by the end of August. Each supervisor will be able to sign up for the classes to fit their schedule by registering in TMS. As we continue working with our labor partners and training our supervisors, we look forward to a great year. Thank you.
Hello, today we're going to give an update on the modernization of Central Texas healthcare system. We will include updates on both our Temple and Waco campus. But before we get started on that, I also wanted to provide an update on our local construction crew. We have a team here in Temple that has been working hard. One of the things they did complete recently was our ICU, and they did an amazing job. They've been approved for additional staff. This will include a night crew where they'll be able to do updates at night when we have less traffic. There's also been a team approved for our Waco campus, so they will also be able to do local construction on our campus site. For updates on our Temple projects, Mr. Yale?
Thank you. We've had quite a bit of construction activity, particularly in the area that was vacated by the emergency department. The first of these projects is the creation of a new packed pain and wound clinic. A primary care clinic was stood up for the Blue Team, and it houses 7 exam rooms. Also part of that project was a pain management clinic, which likewise has 7 exam rooms. And finally, a wound treatment area, which has 2 exam rooms or treatment areas. In the area adjacent to that, we're also creating a new lab draw area, which will have 12 draw stations, which is an increase from the 7 that we currently have. But it also provides a more patient-friendly check-in and check-out process, as well as its own standalone waiting area. In Building 171, we're constructing a new call center, which will have 40 workstations. And finally, within the next 30 days, we'll begin an update of the halls and walls here at the Temple campus, which will include floor finishes and wall finishes, and will be accomplished after hours. So this is just a few of the good things that we're doing here on the Temple campus.
Thank you, Mr. Yale. We are also doing several projects to modernize our Waco campus. On Building 94, we are increasing the number of women's mental health beds in order to meet need. While doing this, we have included fresh paint, flooring, and updating the bathrooms in this area. In early of FY18, this should also include new furniture, not only for the women's area, but also the existing inpatient mental health area. In Building 91, we are updating the first floor in preparation of moving our CLC patients from Building 10 into this area. This area used to house Center of Excellence. Once they moved into their new area, we're preparing this for our CLC patients. The reason for this move is because Building 10 is scheduled for a construction project in the upcoming year. Another area that we're modernizing is our PRRP bedrooms. This is including a fresh coat of paint, updating the floors along with the bathrooms. This is just making the area look more upbeat and appealing for our patients. As more progress is made on our projects, we will ensure to provide those updates to you. Thank you.